Good afternoon. Welcome to the daily briefing. Sorry we're a little late. It's been a busy day. I'm joined here with Chairman Kern from the County Board, and Brian Whitaker will be doing the numbers today in the absence of Sam Bierman and Barb Holt and Mila Blanford. They're all busy somewhere. So we got the pinch hitter in today.
Thank you. So today, for those tested here in St. Clair County, we are at 51,226, which is an increase of 800 new tests in the last 24 hours. For our positivity, we have 4,927 positive cases. That is an increase of 66, and those are males and females under the age of 10 to their 80s, which gives us a daily county positivity rate of 8.3%. For our negatives, we have 46,299 negative tests, and we are happy to report no new deaths today, so that number remains at 160. For those that have completed their IDPH required 10-day isolation period, we are at 4,122. For state totals, the state has tested 3,405,097 tests, with 207,854 positives. That is an increase of 1,773. The state unfortunately did report 12 new deaths today, bringing that total to 7,756. And our thoughts go out to all the families who have lost a loved one due to this COVID-19. For hospitalization numbers, and that is those currently hospitalized in St. Clair County hospitals, we have 51 patients being treated for COVID-related illness, and none of those patients are on ventilators. Each day we talk about our congregate living facilities, and that is those that have staff and or residents with 2 or more in one facility being COVID positive or displaying COVID-like illness, and we're happy to report today there are no changes in our congregate care settings from yesterday. We talk every day about the age range and that we're seeing it lower and lower. One thing startling for us to see today is our highest age range today is those that are in their teens. So we definitely see that this virus is spreading, and it is spreading to younger and younger populations. So, Chairman, you've got some additional information today.
So, and for those that follow us, the positivity rate went down a little bit today. Because we ended up testing more people today than yesterday. We actually had the same 66 is the same number of new positives, but because we tested more, positivity rate went down to 8.3%. But hospitalizations went up about 10% today, from 46 to 51. Those are the numbers that we really drill down on because we want to make sure that the hospitals are not overwhelmed.
Well, and one of those metrics, as we talked yesterday, where our metrics, we went and had to impose additional restrictions because we had 3 consecutive days above 8%. One of those other metrics is if you have a certain amount of days with increased COVID hospitalizations. And in our region, we now have 2 consecutive days of increased COVID hospitalizations. And if we would reach 7, that is another thing that helps in making those mitigation decisions.
So the governor was here today, and that's part of the reason we're late, and I think Herb and I'll discuss that. But testing is a big component of everything we do, testing and then the tracing. And the state has really helped us out a lot. Today we tested in Shiloh. Tomorrow we'll be at Belleville West High School, and then I believe Friday we're at Moody Park in Fairview. These are all testing sites that are available to everybody. We encourage you to go and get tested. It's the testing numbers that are really going to help us isolate COVID-19 and get through this.
Absolutely.
I appreciate you filling in today. You're doing a great job. So let's see if you could do as good with the zip code report. So we'll move into the zip code reports at this time. In 62059, we remain at 10. 62201, we go up 3 to 204. 62203, we remain the same at 167. 62204, we go down 1 today to 124. 62205 goes up 3 to 172. 62206, we remain the same at 369. 62207, we remain the same at 219. In 62208, we go up 3 to 317. 62220 goes up 5 today to 393. 62221 goes up by 10 today to 453. 62223 goes up by 11 to 269. 62225 remains the same at 19, but 62226 goes up by 12 to 523. 62232 goes up by 5 to 115. 62239 stays the same at 60. 62240 stays the same at 19. 62243 goes up by 1 to 39. 62254 goes up by 1 to 151. 62255 stays the same at 14. 62257 stays the same at 26. 62258 stays the same at 87. 62260 stays the same at 80. And 62264 stays the same at 72. 62269 goes up by 6 today to 369. And 62285 remains the same at 48. Herb, we had the governor and Dr. Ezike came to St. Clair County today to detail the new mitigation plans for St. Clair County. And the governor said it best. He said when he was asked, weren't there harsher restrictions that could be placed for the mitigation? He said, we're really acting with a scalpel, and instead of a hatchet. We're seeing where the problems are, and we're trying to do our best to slow the spread with the least impact to business possible. And so we appreciate that because we're all pro-business here. We just know that we got to stop the spread of this virus.
Well, I think you're right. There could have been a hatchet sent from Springfield down this way, but for them to come down, Dr. Ezike, and even make that comment, that tells me that they are concerned. And as we've said all along on these daily briefings, nobody in their right mind wants to see businesses closed down, but we also want to see businesses looking out for the welfare of our citizens and their employees, and I think the majority of them want that also. I was really impressed with Liz, the director of Eastside Health District. You could hear the frustration in her. She pointed out, we've done everything. Senator Belt said the same thing. We're all doing what we can. Team St. Clair is out there every day, sometimes more hours than we probably should be, trying to get the naysayers to understand. And Senator Belt said it best, regardless of what your beliefs are, what your political agenda is, what your religious beliefs are, we got to meet common ground somewhere. Otherwise, we're going to be stuck in this mud hole for months and months to come. I got an email earlier from a friend, that a first responder, that said that he thought that the virus is going to be here forever like the flu. I hope he's wrong. It will be if we don't wear a mask and if we don't do the social distancing.
And look how New York has, now for months we heard about New York, and they had hospital beds in the hallways, and it was a terrible issue, and Governor Cuomo was on every day. Now they have one of the lowest rates in the country. Sure. They're able to open up their schools and do all sorts of things that we can't do because they did all those mitigation things, and they ending up getting their numbers down. Illinois, frankly, is the best of all the states. Our surrounding states all have a higher positivity rate than we do. We're just seeing this resurgence right here in our region, and that's why the state is coming in and making these suggestions to try to get our numbers below 6.5% for a period of 14 days, so then we can go back to where we were, and hopefully then continue that downward trend that we've been on in St. Clair County for a while. We are headed downward in our positivity, but we are part of a greater region that is seeing an uptick in the numbers. So we all work together, we all wear a mask together, and we'll all get there together.
Well, I think it says a lot that Illinois is working with Missouri, because they followed the same hours of the business, the bars and the restaurants closing at 11 p.m. They could have come in and either made it, earlier or later, but we're in this as a region, and like I said, I applaud all the leaders, the mayor of St. Louis, and working back and forth with us over here in Illinois, because it's going to be a team effort, as we said from day one. If you don't do that, I mean, our positivity rate for the region, 8.9. We had anticipated it was even going to be higher, so I'll take 8.9. I want it lower, but we anticipated 9.1 today. So,
And the mayor of East St. Louis was at the briefing, and he's been here as part of our briefings here. But the mayor got COVID. He was straight out with it today, and he has been. It was announced when he had COVID, and I asked him, "How are you feeling? Are you still have symptoms? Have they gone away?" And he said they never go away. He said, "I still am out of breath." He said, "There are things that I just can't do." And he got that infection well over a month ago, probably closer to 45 days ago, and he's still suffering with the symptoms of COVID-19. So this is something that most people, or many people, just don't get over right away. Some have long-lasting impacts, like our friend Mr. Anderson from Fairview Heights that came on. He is still feeling the impact, and he was one of the first people to get COVID in the county.
well, and that's why we've reached out. Tomorrow we'll have a doctor on, I think 3 days this week. We've got the medical experts, and that's what I keep telling our followers and the new people who are joining in that maybe didn't realize that we've had those medical experts on here that has given the advice about wearing the mask, washing your hands, watch your social distancing. So we've got 3 more days this week. We'll have physicians back on. On Friday, we'll have a doctor that's going to talk about those long-term effects of this virus. So you'll definitely want to tune in for that, especially the good members of Team St. Clair who follow us every day. Again, for those of you who are the naysayers and have your own beliefs, more power to you. As Senator Belt said today, we need you to change your mind, but the old saying, you can lead the horse to the trough, but you can't make him drink it, is pretty true, what I've found out over the last several months. So for those members of Team St. Clair, please keep sharing the word, because it's for everybody's good, even the naysayers. If it takes it knocking on their doors, I guess that may be when they realize how serious it is. But as I say, 160 people in our county that aren't with us any longer don't get the choice to wear that mask. And if you want those numbers to increase, then be a part of the problem. But we want to be part of the solution, and that's because we're going to follow the 3 W's and do what's best for all of our citizens here in St. Clair County and in the region. We're in this together. So we appreciate you joining today. Again, sorry for being late, but it's been busy. We'll be back momentarily to have this translated into our Spanish-speaking communities, and then we'll be back tomorrow afternoon with the next briefing.